Good afternoon, ladies and gentlemen who have joined us on this Dr. Fundi channel via multiple social media platforms, via Facebook, via Instagram, via YouTube, and via Twitter. Welcome to you all on this Dr. Fundi channel. This is a digital channel that was set up at the beginning of COVID, last year, with the intention of just, creating a platform for, informing people about various aspects relating to COVID-19, but also to be a platform for conversations about topical issues in the space of healthcare. As we know, there is not much time dedicated to matters of health when you look at mainstream media. So I thought by setting up this platform, one can be able to, facilitate conversations, but also to recognize people who are doing great things, within the field of healthcare, but also beyond, the field of healthcare. My name is Dr. Fundi Lenyati. I'm a family physician in terms of professional training, but I also wear a hat of being a healthcare entrepreneur. But today, as the host of the channel, we are hosting one of our Salute Sunday features, and our special guest is Dr. Thulja Trikamjee. She is a specialist pediatrician and also a subspecialist allergologist. She will talk more about that space. So, but before I actually welcome her formally, I need to just read a little bit about her bio. She just gave me a short bio to the point, which is something that is good, because somebody like her could have given us a long CV that will take us a long time to read. So I've already mentioned she's a specialist pediatrician and allergologist. That is somebody who is a guru on matters of allergies. And being a pediatrician, obviously, she's a guru on those matters relating to young people. All right. She is the only person in this continent of Africa who has a subspecialty certificate in pediatric allergy, a diploma in allergy, and the European Union Medical European Medical Specialist Allergy and Immunology Certificate. She's currently a consultant at the University of Cape Town Lung Institute, where she is an investigator in clinical trials. And she's also actively involved in research in the fields of pediatrics broadly, allergy, and immunology. She also serves on 2 international allergy boards, the World Allergy Organization, and also European Academy of Allergy and Clinical Immunology. She has co-authored several publications in international peer-reviewed journals. She keeps her love for children alive by continuing to practice as a general pediatrician at several practices across the country. The big question I'm going to ask her, with all of these things I've just mentioned, where does she get time to do all of these things? But anyway, she is here. Welcome, Thulja. I'm just going to call you Thulja, if you don't mind.
Yes, perfect. Thank you, Fundi. Thank you for having me, and thank you to the viewers of your show.
Right. So, I'm somebody who's very curious. All right. So I did a bit of background check, to just find out who is the person that I'm hosting today. One thing I picked up that you are a daughter of a priest. All right. A daughter of a Hindu priest, very famous man. So yeah. How is it, to grow up in a family where your parent is a priest?
Well, when you mentioned the long CV,
yeah,
and the fact that I gave you a short one, for starters, this is something that I learned from my father, the Hindu priest, to never ever bombard people with long CVs. And I think that would answer your question, because he was a priest, but he also had a hand, and I think we had a chat about that, in many different fields. So it was very interesting. You grew up as a daughter of a priest, you grew up as a daughter of a lawyer, You grew up as a daughter of somebody who was involved very heavily in football, in our in our apartheid days. So it was, I would say, a very, very fruitful way of growing up, because you had kind of an education, not just from school, but you had a knowledge and a wisdom that got carried to you every day from so many different aspects of life. And I think for a child, it has a lot to do with, or it encourages your emotional maturity as you're growing up in a very big way, to be very open-minded.
And that, you can be able to, mix different things. You don't have to be limited, because, your dad is a lawyer, right? A legal professional who's an executive consultant in one of the legal firms in Durban. But we also know him as a sports, executive or an administrator. Here we talk about Trikamjee. Most people who follow soccer will remember him from the federation days in soccer, NSL days, SAFA days, and he's even playing a role there in sport. But at the same time, he is actually the president, of the Hindu, Mahabasara. Is it
Mahasabha? The South African Hindu Mahasabha.
Exactly, But anyway, this interview is not about him. This is about you. So we are not going to talk much about him. But
Fundile, I must just tell you one thing, if I can mention, because it's the first time I'm mentioning my father professionally in an interview. Is just about a week ago. Him and I had a bit of a quirk with each other about whether I should tell people that I'm Ashwin Trikamjee's daughter, or whether there's going to come a time when he can tell people that he's Thulja Trikamjee's father.
Well, but I hope by now you both have settled that, you can take out that cat from the bag, people, because the tendency, obviously, I can understand, let's say, for you wouldn't want, yes, it's good to know that you come from, your parent has done great things, but you also have got your own journey in terms of your professional journey and everything. You want to be recognized for your own, journey, for your own successes. And if people always bring in, your parents or relatives, then, for me, it does take something out of you. And I invited you here. I didn't even know that you are Ashwin Trikamjee's daughter, but I was just, impressed with the stuff that you have done. And I felt we needed to have this conversation today. Right. So anyway, how many siblings do you have?
I have one sibling, Fundile, Shailen, who's my brother, but I've said this repeatedly. One of the reasons I think I grew up with so much discipline in my home is because even though he was technically my sibling, he behaved more as a second father in my life. and to add to that, I had my grandfather. So growing up, I had my grandfather, my father, and my brother, who was always kind of, in addition to my parents, leading the way by example in, just models and ethics and how I should behave, and just providing me, like you said, about having my own journey, but providing me with the tools so that I could make the most of that journey.
Yes. And so if you can just mention 2 or 3 of those values that were instilled in you in that broader extended family or nuclear family, what would be the things that are like your compass even today, as you navigate life?
Well, I think number one, family. Family is extremely important to us. Each of us has our own professions and we've all got our own friends, but kind of like you said, nuclear family, because I think, and I know in our African culture, traditionally, and our Indian culture, the value of a nuclear family is often lost, but it's something that traditionally we've always held. And I think that there are many benefits to that. So just the value of family and sticking together. The second thing, and I think I must highlight my brother here more than my father and my mother, is discipline. In everything, whether it's discipline in terms of waking up at a specific time. And I must say, Fundile, I was not the star in the house when it came to most of these things. It was my brother. ensuring, I mean, just everything from clean, healthy eating, exercise, and then obviously academics and taking work in school very seriously. And the last thing, I don't like to use the word religion, so I'm going to say spirituality.
Yeah, it's much broader. It's a much broader concept. I actually subscribe to that as well, because sometimes we tend to narrow things to religion, but there's more, you know, and yes, spirituality is something that for me, I like to use that. It's much broader.
Yeah.
All right. Obviously, you are Hindu. Now, when I studied at med school in Natal, so I got to know a little bit about, within, there's Hindi, there's Gujarati, there's Tamil, there's Sikh, and all of that. So which of those, do you come from?
I'm very, very impressed, Fundi. So I am Gujarati. So with Hindu, you've got basically North Indian and South Indian. Yeah, I think in South Africa, that's a nice way, and it's just geographical, the separation in India. Yeah. And then you've got the Hindi and the Gujarati, and then we've got many different dialects among the South Indians as well. But I am Gujarati. So Gujarat was made famous by a man who you probably know of, Mahatma Gandhi. He was Gujarati, and he also played a role in influencing some of our South African leaders during the struggle.
Indeed. Okay, so the last one that is personal, the name Thulja. I was trying to go through to understand the meaning. Can you help me with the meaning of your name? Is that a shortened version, or is that a shortened version of a name? And what is the meaning?
So now I'm going to tell you the truth. I grew up with a Hindu priest, but the Hindu priest I grew up with was not my father. It was my grandfather. Yeah. My father's father was the priest, and he obviously was the person who most people went to, who traditionally opened a book and looked at astrology. You basically look at the alignment of the sun, moon, stars to decide what letters, and it's just basically for good fortune for a child growing up. And obviously when his own grandchildren were born, he was extremely excited and wanted to give them special names. Coming from a religious family, my grandfather was a very firm believer, or a very staunch believer, of the mother, the power of the mother, who is one of the goddesses you must have seen images of. And one of the forms of the goddess is referred to as Thulja. And he took my name. So it's not, when you Google, because I've been asked this by many people, when you look for Hindi names or Hindu names, the name wouldn't come up. He basically took it out from the scripture.
You know what I came up with? I came up with Thulja, which is the Indian goddess of mercy, or slayer of evil. But on
so that's the correct one. Fundile, that's the correct one. It would have been a different spelling, but that's basically the one. You got the correct meaning. That's the goddess of the slayer of evil and mercy.
Okay. No. You see, then that's good. All right. So we're done with that. So you are it's you and your brother growing up in that nuclear family with grandparents, as part of the extended family. What kind of child were you growing up?
I hope my family is not watching. I hope my family is not watching this. Like I said before, I was not the star in the family. I was the one. So my brother was the one who was up every morning, doing the prayers, extremely disciplined, always the model child. I was, being the youngest, as disciplined as I was obviously very spoiled by my grandparents with affection and love, spoiled by both my parents. So I kind of managed to get away with more in terms of being naughty than my brother did. But we had a very balanced life, Fundile. So most people would think you grew up with a priest, that you must have had a very religious or a very strict kind of life. And this was not the case at all. And that's why I mentioned, the many hats my father wore. because religion was one aspect. And then, we did things. Just recently, I was chatting to friends of mine, and they said, you did that when you were young.
Yeah.
My father and mother, every Friday evening, this was now pre-1994.
Yeah.
We used to get dressed up in Durban. And at 10 p.m. on a Friday evening or a Saturday evening, we always knew the new movies that were out at the cinema. My parents love movies, English movies, mainstream Hollywood movies. And we would go to the movies at 10 p.m. at night, get dressed up and go to the movies and come back from the movies at midnight. Then go to a coffee shop. There were a few coffee shops that would be open. People who grew up in Durban, probably you, Fundile, would remember there was a place called Legends in Musgrave.
Yes,
and again, this was now Musgrave pre-1994. So it was a time when people of color were not abundant in that area, and obviously not as welcome as they are now. We would go there.
It was a Lani area, Musgrave.
Yes.
That was before Mhlanga, or even what's this other mall as you pass Pine Town, Pavilion. Yeah, that was before.
Yeah. So this was a time when we weren't allowed to live in Musgrave. Subsequent to 94, we moved there, but we would go out and go to the movies. And I remember my friends used to be flabbergasted by this idea, thinking, "You mean you went to the movies in West Street at BP Center at 10 o'clock in the night with your mother and father?" But that's the balance. Is there was prayers, and every day with my grandparents, there was lots of discipline. And there was a lot of fun. And that's where also the family value comes in, because we had fun. But my brother and I grew up being able to have fun with my mom and dad. We never found the need to go out and do things behind their back, because everything that we wanted to do recreationally and socially, we did with our parents, and we enjoyed their company.
Obviously, that improved the bonding, amongst you guys, you and your parents and you and your sibling. Because we were doing everything together.
Yes.
All right. So if you now reflect back, which of those things that were instilled in you are still guiding you today? I mean, you've mentioned the discipline, you've mentioned, importance of family, you've mentioned, the fact that, it was not a very strict environment, despite what one would think, coming from a home of a priest.
I would say the spirituality part, Fundile. I think just having not even religion, but having the spirituality always reminds you that there's something larger than you.
Yes.
And no matter where you go in life, at each step of our life, we're obviously in different phases. And whether you're at the top, middle, or bottom of your game, you're going to feel how you feel where you are. And when you're always reminded of something greater and bigger than you, it's very humbling.
Yeah.
So I would say that just if there's one thing that I have taken from everything, including the discipline, growing up with religion, and the family values, it's remaining humble. The humility came from my family, constantly allowing me to shine, but also bringing me back down to earth. Which they still do. My brother's 2 children, my niece and nephew, do that to me now as well. And it's just, and I think it's very nice when you have that type of relationship in a family. And like just allowing you to have the wings, but not getting ahead of yourself.
Beautiful, beautiful. So in my other homework that I was doing, again, around this name of yours, trying to see, okay, they say these Thulja, they tend to be independent-minded, they tend to be hardworking, diligent people, energetic. I think I can pick up the energy from here, and very self-confident, and they tend to gravitate towards much more technical or mechanical fields of endeavor, that is sciences, ambitious, courageous, self-reliant, but you like a bit of order. You don't want, you don't do well where things just change abruptly. You like to work within a stable environment. Are there any of those things that actually apply to you?
Well, I'm a Virgo. So Virgos, as you know, are perfectionists and very obsessive compulsive traditionally.
Yeah.
That said, again, I think I am a hard worker, but I think I have a good balance, Fundile. It's a pity you don't have some of my colleagues, my medical colleagues, some of them you might even know, who would testify to you and tell you that, you know, we don't understand how Thulja gets this far in life because she doesn't like to study half as much as we do. She hates reading. She'll never pick up a book. So it's, you know, I think in terms of having order in certain aspects, not in everything. And I think always having a balance is extremely important.
Beautiful, beautiful. All right, let's get through your schooling life. Any highlights worth mentioning, especially in secondary education?
Well, I was in primary school and in high school in government schools. You know, I went through the normal South African government schooling, which I appreciate, because I think that gives you a really good foundation of an idea, especially when you're a doctor and you're dealing with children from all types of backgrounds, of what and where different kinds of families and patients come from. I would say, and I think this one is important, and it might answer another question you have for me. When I was in high school, there was a program or a production company. It was in 1997, if I remember correctly, that had come from some other part of Africa, and they were doing a program for SABC. They were filming a series of episodes called Picture Our Past. And the entire concept was, we take young students, 2 students anchor each show, and we go through history in South Africa. And each episode covers a new thing. And history means you take the kids and you walk to the beach, and then you go to the museum. We went to the South African Museum, and we pulled out old photographs of what the beach looked like in the 1940s and 1950s, specifically those benches that said whites only, and how Indian people were only allowed to sell sugarcane on the beaches. You weren't allowed. We picked up a few names that were actually arrested because they stepped foot in a white only area, and they were someone of color, and had to go out and interview them. So the one episode was on the beaches. The second episode that I was part of was on schools, the history of schools in South Africa. And the idea of this was doing a government school, which was a previously very disadvantaged school, a medium school, which was a school which I would say, you know, Indian children went to at that time when we divided color in schools, and a fully private school. I was obviously in the middle, but we went to the township school. And Fundile, this was my first time. I was about 14 years old or 13 years old. This was the first time I drove into the thick of a township, right in the middle of it. They took me to Inanda. And we went to Oshlange High School, which, as you know, which is where Nelson Mandela cast his vote. In April 1994. That was John Dube's start of, he was the first president of the ANC. And that visit at that school, seeing children who didn't have uniforms, didn't have pens or pencils, were running around, and were so excited that I was just a child myself, but treated me like a celebrity and treated us like we were coming from somewhere. It was an aha moment in my brain. I still remember exactly how I felt. I had never seen that type of poverty. I had never seen that type of enthusiasm to study and learn. And I kind of at that point decided, I didn't know I wanted to do medicine, but I wanted to do something that made some sort of impact in whatever way to South Africa, because I could now see the varied levels at which South Africans lived because of our past.
All right. So that was an aha moment for you, because you were now being exposed to the actual, you know, realities, you know, of the policies of the past, and how, the segregation and the, differential levels of access to various amenities. And obviously, was it the time of the tricameral, or was it already past that?
It was past. It was already past. Yeah, it was past. It was totally past that. And another thing about that story, Fundile, is when I did my community service, I think being a doctor, that we sometimes have a bit of disarray and, with the posts. And you basically get told, well, this is where you're going to go. I ended up being posted in Inanda to the community health clinic that serviced the area of Oshlange High School. Yes. So I spent 1 year servicing that community through no choice of my own, just because I would call it fortune put me there. Yeah.
But now when you look back, because again, there's this thing that, there are no coincidences, that time that you spent there, it was not your choice, but you spent it there anyway. How would you say it shaped you now as you were refining your thoughts around what specialty you wanted to do, within the field of medicine?
Well, unfortunately, this is not an inspirational answer. Inanda is, as you know, it's extremely rural, specific parts of Inanda. And we were placed, our clinic was very rural. It was across from a Shubin and a police station. So we saw lots of trauma. And because it was a CHC, when you were on call, it was just you. It was one doctor alone. Yeah. And if you were on call on a Friday or a Saturday, the stab wounds and, the domestic violence and sometimes even gunshots and policewomen and policemen coming in would just come in all the time. Sometimes minor issues, sometimes major issues. And that's when I decided that I want to treat children who are innocent. Yeah. I do not want to see adults. And, I feel like because we also worked there with children, we had a little children's clinic, and I realized that if we could make a difference somehow, always. And I think this is what Nelson Mandela always said, you make a difference in the lives. If you want to impact a community, a country, or the world, you start with the children. And I felt like if we could give better education or better medical care to children, they would eventually grow up to be better citizens in society and hopefully not end up in situations like that.
Indeed. Yeah. And that makes a lot of sense. But also, there is that sense that after you've done your rotations on the different, fields of medicine, that, what, I would rather stick with kids. If they have a problem and I give them proper treatment, there is no faking, they will actually, show that I'm well now. Unlike some of the older patients who, for other reasons, they may still pretend that they have not recovered only because there are other issues.
I must admit, Fundile, when I was an intern and I did the 2-year internship, so I rotated through everything. Yeah, I did not like pediatrics at all. I enjoyed the department. Yeah. But you've worked at King Edward Hospital. It's extremely busy, and emotionally, I found it very emotionally taxing when you saw children suffer. Yeah. This was now early 2000s. So, our HIV rate was still quite high. Our TB rate was still quite high. So we saw lots of children that were victims to that. And lots of children who, needed urgent treatment but wouldn't get it. And that sort of kind of demotivates you in a way. Yeah. So I didn't enjoy pediatrics as much then, but I think it was after I went to a rural area and I realized, well, if I want to make a difference in society, and this is a society I'm working in, that the best way to do this is with children.
Yeah. All right. So just a little bit backward, when you qualified as a doctor, what did your parents say? Remember, you're coming from a home where your dad was a top lawyer, an executive of sports, and all of these other things. But the main thing about him is that he's a qualified lawyer.
Yeah. So, Fundile, the short answer is everyone in my family is education was always very important. My dad is an attorney. My mom is a social worker. My brother is a chartered accountant, and his wife is as well. So the first thing is, when I became a doctor, as proud as they were of me, it wasn't that big a deal. Yeah. Because education was important anyway. Yeah. You've got the tools, you've gotten the support, as happy and proud as they were. And that's where the humbling part comes in. You weren't put on a pedestal because you have now the DR title and you're a doctor. Yeah. So, in terms of education, my family was always very, very focused on making sure that you got a tertiary education. Yes. What you did was your decision. There weren't any doctors in my family, but I could have been a psychologist, or I could have done law or social work, and I think my family would have been equally proud of me. I don't think the doctor title or being a doctor was anything that they were very chuffed by alone. Yeah, beautiful. But at least they had given you space to make your own choice, and you had now started to achieve some of your goals in the choices that we had made. Absolutely. Right? Okay, so what I had said when I was advertising this conversation was that I'll also ask some moms or dads who have got, kids who might want to ask a question or two. Obviously, that does not substitute their treating doctors, but, if they had a question, especially on matters of allergy, where you are the guru, So I'm asking people now to send through questions via Facebook or YouTube or any other channel so that we can read some of those questions. I think there's a first question that has come through. I'm going to ask the lady who is assisting me to just ask you the first question, if you don't mind. Okay. All right.
Good afternoon, doctors. We have one comment and a question for Mamo Temaraba. She wrote, "Thanks, Dr. Nyati, for inviting Dr. Thulja. There aren't many certified allergists in South Africa. In fact, she's the first and only one I know." And then a question, I've got a couple of questions around food allergies and intolerance in babies. Firstly, does Dr. Thulja do online consultations since she's not based in Johannesburg? Thank you.
Yes, I do online consultations, and you can get my email address from Dr. Fundi, or you could contact me on Facebook on Messenger, and I do consult patients at Sunning Hill Hospital as well. Thank you for your question.
All right. Maybe now that she touched a little bit, you're talking in general now about food allergies. Maybe can you just touch on that just for the benefit of people, food allergies in children, how common are they? Do people outgrow them? What are the common ones? Just to, share info around that.
So the first thing, Fundile, is food allergies are becoming very common. I'm sure, we're hearing about them more now than ever before. And this is a global problem. We're seeing this all around the world. But, and this is why it's so important for mums like our viewer to see a certified allergist, because lots of food allergies are improperly diagnosed in that true food allergy, meaning that the allergy or the reaction comes from your immune system, is very often either misinterpreted by something that might be a rash or a food intolerance, or sometimes it can be incorrectly diagnosed. And the problem with that is that it has a huge impact on mums and on kids in terms of what they can eat and what they can't eat. So my first point, and I would say is a takeaway, is true food allergy. As high as our levels are going now, higher than before, they are not as high as we perceive them. So I often say perceived food allergy is 1%, and then actual food allergy is another percentage. And the good news, the silver lining here, is that even though food allergy is going up, because so many people who have perceived food allergy don't truly have a food allergy, it's good news, because you can basically, what I call, undiagnose your food allergy if you go to the correct doctor and get the correct tests done. Especially in Johannesburg, I have so many patients who come to the rooms who have had a peanut allergy or a milk allergy
Yes.
for 7 or 8 years. I've fed them peanut butter in the rooms, made them drink milk. So they come in for a consultation and they walk out of the consultation having a clearer picture of what they are allergic to, but now completely safe to consume ice cream and cheese and yogurt and no longer have to be afraid of peanut butter and cakes that might have peanut traces in it. So I think that's very important about food allergy.
Yeah, you know, the distinction between food intolerances versus the true allergies, you know, maybe you can just say something around that, you know, just a little bit about that. I know you've touched on it already.
Yeah. So the food intolerances are basically those things that you would get to things like gluten and to lactose, right? And lactose and gluten are carbohydrates. Right? Yes. So what happens is with an intolerance, it goes into your tummy and your tummy is going to have a bit of the reactions. Those people who say, we feel bloated, we feel constipated, every time we drink milk, it kind of makes us either have diarrhea or we find there's a change in the color or the consistency of our stool. We just feel very lethargic and tired. It's mostly gut issues and tiredness. That's not, in fact, a proper allergy, and that's to a carbohydrate. An actual allergy occurs to the protein. So if you take milk, for example, it's the casein, which is a protein in the milk. And when that casein touches your mouth, our mouth and our lips are full of lots of little immune cells. Those immune cells identify it, and they would say, right, I am Fundile's immune cells. He's drinking milk. We need to react now. And you would immediately get a reaction. And those reactions are, those pictures I always tell patients, you know, you see on Google and you see on American movies of the kid with a peanut allergy, swollen eye, swollen lip. Those are now tight chest. You need to go to the ER. So every day, Fundile, I see patients who come to me. And when I ask them about milk and gluten, 90% of them will say, yes, well, actually, I do have a reaction. So it's very important to have that distinction. That was a very good question. Yeah.
You know, when my daughter was at prep school, I think she was doing grade 3. So the school wrote to us as parents to say, there is a kid here at school who's got peanut allergy. So as a result of the fact that there is a kid with peanut allergy, we want to advise all parents that no kid should actually bring food that has got, you know, peanut, and also that there should be no sharing of food. Because kids sometimes, you know, they say, oh, this is what I have in my lunchbox, and they share the lunchbox and stuff. But they took it to a drastic level, you know, and I sort of challenged them because I thought what they were putting in place was a bit drastic and it was not based on science. But anyway, so the issue of peanut allergy in schools, it's a big issue, and sometimes the schools, they give advice that is not really informed. But do you want to say anything about that?
Absolutely. So Fundile, firstly, what I want to say is that is actually very good that the school did that. Because in fact, in first world countries, if there's a child with an allergy, that is what should happen. Now, this brings me back to another topic about that, but this is why I like to do as much education on allergy as possible, because this is presumably a private school in Johannesburg, in an urban area in Johannesburg.
Yes.
What happens to the rural schools if there is a child with peanut allergy, with a proper peanut allergy? How protected is that child? How do they have access to an allergologist? Who's going to diagnose them? And if something happens, God forbid, to a child in a rural area, and maybe there is a mortality associated with it, are we even picking it up as a South African healthcare service? Do we even know that this is how this child passed away? Because most of us who've gone through the South African healthcare system, internship, comm service, we know that when you're in a rural area, postmortems, investigations, it's not as academic as it might be in the city centers and in the academic hospitals. So the number of food allergies, because it's rising in our African population as well. We're doing research in that right now, and we're showing that it's rising in rural Eastern Cape. And that basically is giving us an idea that among Black ethnic African people, we're also seeing food allergy. So my first comment there is it's great. I'm actually happy that, you know, your child's class had that in place. Because we have so many schools that don't have that. But the second aspect is, yes, you're 100% correct. And I've seen that so many times where that has happened. But when I've done the correct testing to the correct proteins to the child, I was able to, in a graded way, introduce the peanut butter or the peanut flour into the child's diet. And now you've improved that child's quality of life. You've improved their mother, father, and family's quality of life. And you've essentially improved the entire class and their quality of life too.
Is that what you call a desensitization process?
Yes, so it depends. So with the desensitization, they would be allergic already, and we give them small amounts of peanut flour or peanut protein over short periods of time. And we do that in South Africa with peanut. And a lot of them just grow out of it as they grow older. And if you don't assess it, you don't pick it up. So when they've grown out of it, then we do food challenges. So we would call it an oral food challenge, where you follow a protocol and you feed them increasing amounts of peanut protein in the form of peanut butter.
All right. So at least you've dispensed with that question from Mamuti. All right, let's go back then. So you're now doing PEDS. I mean, I'm skipping the fact that obviously you have to be a registrar and work very, very hard. You know, so it's general pediatrics. So at what point did you then say, man, I don't want to just be a general pediatrician. I want to go further and actually be a super specialist in something within pediatrics?
So Fundile, I love critical care. I love ICU. And I spent a lot of time in ICU in my rotations as a pediatrics registrar. So I wanted to do pulmonology. As you know, getting into subspecialty posts at that time, it was extremely difficult because they weren't posts. It was the time that they had frozen many of the posts. And this is why I say my spirituality and my faith and belief always kind of has never let me down. I never went chasing after any subspecialty. I got a phone call from Professor Mike Levine, who's the head of pediatric allergy at Red Cross, to say that he's heard that I want to do pulmonology. He has a recommendation that, that I would be a candidate to start. There is a new subspecialty. It's now a certificate. It's a 2-year subspecialty. And he wants to apply for a scholarship for the Discovery Award for this. And I remember saying yes immediately, thinking there's no chance that this will materialize, so it's okay, because it's not like I'm going to say yes and I have to back down, because I had no intention of leaving home and moving to Cape Town, zero. And I just said yes, thinking there's a 10% chance that it will happen. I'll cross that bridge when I get to it. And then one morning I was post-call from a call all night, and I get a phone call to say, when would you like to start? So I said, start what? Start where? And he said, at Red Cross, you've got this post. And so we had applied through the Discovery Foundation. You know that they are sponsoring specialists, subspecialists, and research every year, especially in key areas. And because allergy was a new subspecialty, it was something that they were very interested in investing in and looking for a candidate. And yes, 1 month later, I was packed up and I was in Cape Town. And the rest is history.
Mom and dad and the family, going away more than 1,000 k's away.
Well, I don't think they were initially very excited about it. But I think when I explained the opportunity and the fact that this would give me, it was the education to start with. But the niche of being able to study something where I would be one of the first to study this and graduate, and then obviously use that to make a difference. I think they were extremely encouraging. Obviously, mom and dad thought I would come back after 2 years. But they were extremely encouraging. So I had to make sure that I was graduating each year just to make them know that this was the right decision to pack me up and send me to Cape Town.
Yeah. All right. Just for the benefit of some of our listeners who may not be medical doctors, or even medical doctors, who don't have a deeper knowledge or understanding of the subspecialty. Just overall, what would you say when you say you deal with allergies broadly? What do you deal with?
So allergies, this allergy and immunology go hand in hand. Most of our organizations are like the European and the American academies where allergy and immunology. And I think it's key to say immunology because allergies come from our immune system. Yes. Our immune system is a large organ that impacts many different parts of the body. Yeah. So when you have, we talked about food allergy. So you eat a peanut, if you're allergic to it, you're going to get a swelling on your eye or a swelling on your lip. That now is an allergic reaction and your immune system is reacting. If you are allergic to dust or grass, this now is considered an environmental allergy. And what happens is when you come into contact with something in the environment that you're allergic to, what would happen is then either your eyes would start itching. So people who are constantly rubbing their eyes or have pink eye or allergic conjunctivitis, yes, classic allergy, and this is all part of the fields that we specialize in, rhinitis or hay fever, which is proven to be the commonest chronic condition in the world. More than 30% of the planet suffers from hay fever. That is an allergy. Asthma, more than 50% of asthmatics, and we know asthma mortality is a huge issue, especially in South Africa. Controlling asthma mortality, especially in our adults, is something that's even part of our Millennium Development Goals in our under 34 age group. So, and then again, wheezing and asthma in children, our under 5 mortality is a very big thing in our Millennium Development Goals for our country. So all of that encompasses allergy. And then we also have other things like urticaria, people who just have sudden itching on their bodies. And we also do a lot of the immune deficiencies. So people who might have an issue and constantly get infections, I think that also encompasses allergy too.
All right. So, the family connection when it comes to allergies, I want you to just touch on that, does it run in families? And also that, whilst there are all these manifestations, skin, eye, the nose, sinuses, food, and even the chest, you may have all of them, or you may have one of them, or you may have one when you were younger and later you have another. Just a little bit about that.
Yes. So yes, number one, yes, it does run in families. There is a family kind of tendency, what we call an atopic tendency. So it doesn't mean if the father or mother has asthma, the child would get asthma. Potentially the father has asthma and the child could develop a milk allergy. Or the father might just have hay fever and the child would get eczema. It's a big one I forgot to mention when I talked about the conditions we manage. But allergies and atopy all kind of go together. So if there's a family history of any of those things, there is a higher risk of the child developing allergies. And if it's your mother or your father, which is our first degree relatives, or if it's your sibling, then there's an even higher chance of getting allergies. And then in terms of the way the allergies work is we have something which we call an allergic march or an atopic march, which usually starts off with a bit of eczema when babies are young. I often in general peds, when you get called to the labor ward or you seeing the babies day 1 post Caesar, day 2, when you see the cradle cap on the scalp, I always tell the mom, you must be careful of allergies here. And I've had a few moms already come back to me 6 months later saying, but how did you know on the second day the child was born that my child was going to have allergies? Because that's now considered one of the first signs, because our head has got such a large surface area. When they have cradle cap, it's dry scalp. And then from the eczema, eventually they develop food allergy, those children. They tend to. So that's your milk, then your egg, and generally after that, your nuts. And after that, they tend to develop a bit of hay fever, runny nose, constantly getting sick. And all these things are important to manage properly, because if you don't manage all of this properly when they're younger, they then go into developing asthma later on in life. And they follow that proper allergic march. Lots of parents tell me, Fundile, that, but we grew out of it. Why do we have to give our kids treatment? Because we grew out of it. We wheezed when we were younger, and now we much better. So it's okay if we don't give our kids treatment. And my answer to that is that our time that we're currently living in influences allergies in a big way. So climate change is a very huge influencing factor, and the quality of the air that we're breathing, the quality of the food that we're eating. And it's one of the reasons that allergies are more prevalent. So children today, even if they have the same family risk that we had when we were babies, children today are more at risk of becoming asthmatic, or more at risk of becoming eczematous or having food allergies than children were 20 years ago if they had the same genetic risk.
So any role, I know you've just touched on foods, with our move to becoming more urban and the foods being more highly processed type of foods, has there been any link between maybe more sensitization that is happening because of some of all these things that we find in the processed foods that were not there before, because we tended to eat much more organic type of foods?
Yes, 100%. So I think the food, but just the lifestyle, Fundile. So you mentioned it when we started, but we are now currently doing studies in South Africa where we're comparing urban and rural.
Yes.
Unfortunately, we can't say that it's only the food, because there are so many other factors. But what we are comparing is just the home that the child lives in. And in rural areas, children are living far more natural lifestyles. And another key is that they are not being kept in bubbles. They're being exposed to everything. So they're drinking water from the river. They're eating off the floor. They are playing with the roosters and the chickens. And they are eating everything raw. They're sleeping with dogs and cats and cattle. All of that exposure, but they have far less allergies than children in urban areas. And the whole idea of this started internationally in USA among the Amish community, because they found that the Amish, who are completely natural, had almost zero allergy. And that alerted the world to the idea that maybe a more natural lifestyle is protective against allergies. And then we found that studies started springing around all around the world where they were comparing rural populations and urban populations. We're still getting more data in from our current study in South Africa called the SAFA study. It's a South African food sensitization and food allergy study. But we've, with that, proven that African children are getting more food allergy now than before, but it's still less. It's still less because they are eating natural foods compared to urban Cape Town. And their asthma is less, their eczema is less, and even the amount of allergens in the dust, in the little beds that they sleep on the floor, is far less.
Yes. Is that because on Thursday, you actually, posted that on your Facebook, an article that was published in the Pediatric Allergy Immunology, right?
Yes.
Association between environmental dust composition and atopic dermatitis in urban and rural settings. In simple language, in simple non-medical language, what are you guys finding?
So what we did here, in simple language, everybody finds this so interesting, is we bought vacuum cleaners from London, special ones, and we vacuumed up 1 by 1 meter a bed, mattresses of children here in Cape Town who live in middle-class families, go to middle-class schools. And we vacuumed the same 1 meter of the children in the rural areas who are sleeping on the floor, just a sheet that they're sleeping on. We froze the dust in a freezer, and then we analyzed and we looked at the dust. And we said, well, how much of dust mite is in it? And dust mite is something that was prevalent in both in urban and rural. And then we looked at cat, dog, cockroach, bacteria. And we found that certain things like the bacteria, which we refer to as endotoxin, is much more in the rural areas.
Yeah.
But those children do have less allergies. And that brings the whole answer to, if you get healthy bacteria exposure, if you get healthy exposure to good bugs, that's actually protective against allergies in your life.
Beautiful, beautiful, beautiful. And so this is an ongoing study, or you guys are done with the study?
So the dust aspect has been done, but some of the data, obviously we did the dust, we looked at food allergy, we looked at rhinitis, asthma, and atopic dermatitis. So there's more, and as more and more data is coming through, we're doing more comparisons. So more of it is coming out.
Beautiful, beautiful. So I asked you earlier, where do you get the time? You're doing research, you are seeing patients. Are you also lecturing?
Well, sometimes.
Sometimes. You work
but
in
not, I'm not a full-time lecturer.
And you work in Durban?
Yes, I do.
All right. So when people want to consult you, how long is the queue? Are you the kind of specialist who gives a date 6 months from now and all of that?
No, fortunately, it hasn't come to that yet. Fundi, and with technology, COVID has taught us that you don't have to fly to Durban and you don't have to fly to Johannesburg. So it's made it much easier. And I must say, honestly, the last year, I'm actually finding I'm having lots of time. And I tried to think about why this was the case. And I realized it's because, ordinarily, if you and I had to do this interview, I would have to plan this. I would have to book out 2 hours. I would have to get ready. I would have to drive to you. I would have to drive back. And it's the same with our consultations and international meetings, where you're traveling and you're going overseas. It's cut out so much of time that it's now possible to be able to be on your laptop and be attending a meeting, but editing an article at the same time.
Yeah. Wow, that's good. So that's good. So, Doc, I think there's another question. Let me just see if this question is still there. Nwamisa, can you please ask the question, please?
Okay, Doc, we have a question from Mamo Temaraba. She's asking, my 13-year-old baby has what her pediatrician assumes could be an allergic reaction to wheat. The reason being that she vomits every time she eats anything that contains wheat. Could this be true? That's the only we have. Thank you.
Can you read that question again?
Okay. My 13-year-old baby has what her pediatrician assumes could be an allergic reaction to wheat. The reason being that she vomits every time she eats anything that contains wheat. Could this be true?
Okay, so I'm not sure if she typed year instead of month incorrectly, because she said 13 years and then she said baby. So I'm just going to give you both examples. If she is 13 years old and she had wheat before, she tolerated wheat previously, then it's very unlikely that she's going to be allergic to wheat now. It's more likely that there's some other factors involved in what she's eating, or it could be an intolerance. If she's 13 months old, then also, again, it's very, very unlikely that wheat alone is an allergy. So what I would say is that she needs to be tested, either a skin test where we put the protein from the wheat onto the skin, or a blood test where the component itself is tested so that you know for sure. The bottom line is, if she's eaten wheat many times before, whether she's 13 months or 13 years, if she's eaten it many times before and she tolerated it without a reaction, it's very unlikely that she is allergic to it.
Okay. All right. So just whilst we are talking about, the test. So if, let's say, I come from that family of people with allergies, various forms of allergies, and I want to be proactive, are there tests that I could actually, I'm not talking about me, let's say I'm a mother or a father to a kid, and I'm worried that maybe that kid could also, have the situation. Are there tests You've mentioned skin tests, but also are there broad tests? Obviously, you can't have tests for each and every potential allergen out there, but are there tests that, you know, a pediatrician, you know, or, you know, somebody like you, who's a super specialist, can actually do to rule out most common type of allergies and be able to say to me, it's most likely that this kid is going to have, you know, this situation, or no, from these tests, it looks like it's unlikely.
Yeah, okay. So the first thing is, I'm so glad you asked this question, Fundile, because as allergists, we don't believe in panels of tests generally, because my golden rule is to moms and also to clinicians, if a child is eating something and they are not reacting, don't test it. Each test costs money. Yes. But if there is sometimes a slight reactivity in the test, it's going to give you a false positive, and you're now going to eliminate something from a child's diet, which a child is not allergic to, which is going to have a huge impact on their life. So the way that test must be performed is it must be very specific. It must be either the foods that this child is allergic to, or something that the child reacted to, or something that the mom has never exposed the child to before, if you're screening. If they've already had it, then we don't need to do the test. And then in terms of the types of tests, right, we have a skin test where on a hand, we would put drops of the protein onto the skin. And then based on the reaction on the skin, because our skin is part of our immune system, and our immune system usually reacts when you have an allergy, we then measure it. And based on the size of the reaction on your hand, we could tell a mom, okay, well, this is very big, so this is a bad allergy, or this is tiny, let's repeat it in 6 months, and let's see, maybe the child would have grown out of it. And with the blood test as well, we do the blood test and we look at the level, and based on the level, we could give mom an indication of how bad or how severe the allergy is, and if there is a chance that the child could grow out of the allergy. My aim always when it comes to food allergy, Fundile, it puts me out of business, but this is my aim, is your aim should always be to get the child not allergic. It shouldn't be to diagnose the allergy. Anybody can do that. It's to promote tolerance in a child, because when you're promoting tolerance and you're getting a child to eat something, then you're changing their life and you're basically curing that allergy. So you need to catch that level at the correct time and slowly start introducing the food into the diet. The best consultations are the ones where the child comes to your room not able to eat ice cream, and they leave, and the mother takes them straight to the ice cream parlor, and then I get a message to say, we're eating ice cream, thank you so much. There's no milk allergy.
Right. So is there a situation, and this one goes beyond your age, you know, the target age of children, but, you know, you have been, let's say one has been eating this food with these spices, basil, pesto, and all of those other things, no problems, right? But then, you know, as they become young adults, one day they are in a restaurant and they are eating the very thing that they are used to eating. All of a sudden, they have this sudden reaction, swollen lips, you know, sometimes, you know, may even have, a situation where they need to be rushed to ER because they are like closing up, you know, their windpipe, you know, the larynx. So yeah, just you know, I've been asked a lot of that, you know, can I be allergic to something that I used to tolerate for years before?
So certain things, yes. So number one is the way an allergy works is once your body gets exposed to something, it's like the vaccine. Your body makes antibodies. So for most of the stuff, the milk, the egg, the nuts, you're going to have antibodies for it, and you're not going to suddenly become allergic to it. But some of the things, and the one big example that you can tolerate your whole life and become allergic later on is seafood. So you find very often seafood is a big factor when it comes to adult allergy. And the second thing is all the preservatives, Fundile. So your tartrazine, your sulfite, your sodium benzoate, your colorants, MSG, those kind of things. You find children ate lots of junk when they were small and they were fine. But as they grew older, they start having reactions to these things. Those are also things that they can tend to start having reactions to later on in their lives. And the last thing with people who have those allergies is sometimes they could be allergic to something else in the environment. So the classic one, because we mentioned seafood, is people who are very allergic to dust mite, house dust mite. Dust mite is a crustacean. It's part of a family of organisms. And shellfish comes from the same family. So very, very often people have eaten shellfish their entire life. But they say to me, 3 times only when we were at a restaurant or we were somewhere, we ate the shellfish and we suddenly started feeling itching in our throat. Our lip got swollen. And when we test the shellfish, it's negative. And I say, well, let's test the dust mite as well. And the dust mite comes back high. And that's something we call a cross-reactivity. And I'm mentioning it because it's very common. Dust mite allergy is one of the commonest allergies that we see. And I see lots of adults who have had that, you know, and it's scary when you have a tickle in your throat and you're not sure what to do. It's very, very scary.
So you've just mentioned the issue of dust mites. You know, most people don't know what these things are, but in a normal home, where would you normally find them? You know, you normally hear of advice where you say, you know, if you've got a child with allergies, who've got asthma and whatever, please remove the carpet or this type of pillows or whatever. You know, can just touch on that. I know I'm just asking on behalf of my viewers.
So dust mite, firstly, the most important and commonest allergy that we see in the study we did now, more than 90% of rural homes and 90% of urban homes, dust mite prevalence. So it's now even in rural areas, you see lots of house dust mite. It's in upholstery. So the dust mite is in the carpets, in the pillows, in the mattresses, in your curtains, in your sofas. Those are the areas you're going to see dust mite. That's why many patients are struggling now, Fundi, during COVID. Because they are forced inside their homes. They're spending more time indoors. And now in winter, especially, the blankets are out, the pillows are out, the heater is on. We're not opening our windows. So the dust in our home, it's circulating dust mite. So they're getting very fluey and they're getting very nasal. And then, you know, that's the issue because when you get nasal, your immediate thought is, what if I have COVID? So, you know, there's so many implications to allergy itself, especially at this time, and managing the allergies properly, because patients who now we obviously are all trying to stay at home. But if you've got bad allergies throughout this entire pandemic, when you go out into the world, if you have a runny nose or an itchy nose, or if you are going to sneeze, that is going to put you at increased risk of developing COVID. Because when you sneeze, you need to push your mask down. So you are opening yourself to be vulnerable, but you're passing your droplets to everyone else as well. And you also rubbing your nose. So you're touching things and you're touching your nose. So that's why the hay fever and the environmental allergies are so incredibly important to treat now at this time. And removing dust in your homes, it's not as simple as just wiping the tabletops. It's not always possible because dust mites are here. I had a joke with a patient recently who wanted to move his house. And I said, you know, there are more dust mites on the planet than there are human beings. It doesn't matter where you go, we are outnumbered. They literally are. So it's just your mattress and your pillow cover. For me, those are the 2 important places to keep clean because we spend 7 or 8 hours every day where your skin is touching your mattress. It's lying on it. Your head and your face is touching your pillow. So if you get those clean, washing them at like a higher temperature or making sure that if you are allergic, I don't want people who are not allergic to do these things, but if you are allergic, making sure that you get proper bedding, you get linen that is impermeable to dust. So it means the dust doesn't come out and irritate you. Those simple things go a long way.
All right. So as we work towards wrapping up our conversation, so you are at the top of your game. You know, you are the first one in the continent. to be certified, and obviously you have a responsibility now. They say you must lift as you rise. So as you are rising, you have a duty to lift others. What are you doing to lift other medics and also, other health fields that are related, like maybe some nurses or whatever, who are also having interest in this space?
Yeah, I think there's two aspects to that, Fundile. The first thing is the science way, because of my affiliation with many of the organizations overseas. I feel that I have a responsibility to bring the science and the medicine, because healthcare should be healthcare. They shouldn't be first world and third world when you're talking about healthcare.
Yeah.
So our patients in South Africa should have access to the best scientifically.
Yeah.
If the government can afford it, or even if you're in the private sector, we should have cutting edge medicine. So what I have been trying from the time I've been qualified is bringing cutting edge science from my meetings and my colleagues in Europe and all parts of the world, and trying to do that with our patients so that we could put South Africa in terms of allergy and immunology. We could put South Africa on the map, and that more importantly, our patients are getting the best treatment they could possibly get. So that's the one part that I'm very passionate about, because the field of allergy and immunology is evolving all the time. And I feel we do need to keep up to date with it. And patients have a right to the best of science, whether it's private or public. And regarding lifting other people up, I think that's in terms of our medical students, educating them, because I was one of those students who didn't even know that allergy was a subspecialty. I then became a pediatrician. I still didn't know that allergy was a subspecialty. So getting the word out there to more and more medical students so that they know this is a field, it's a big field, and it's something that is very interesting and very encouraging. So we've got a mentorship program where we've got students who come to the Lung Institute, who sit with us throughout the year. Obviously, it's not possible during COVID, and we're meeting them via Zoom, but basically giving them a glimpse into what we do, some of our clinical trials. So there's the aspect of students wanting to treat patients and students also wanting to go into the science, so that we can establish proper health, a proper facility for allergy. And then I think lastly, also just making sure that people are aware. The awareness for allergy is a big thing. That is our patients, and these are all the people who are watching your show. If you've got an allergic condition, there is no point that I've studied and I've done the subspecialty, but people don't have access if they've got a child with peanut allergy, or they're not aware that, wait a minute, I don't have to live with this allergy. I can actually cure it. So for me, the awareness is extremely huge, because I often find moms telling me, we never heard of an allergologist. Our whole life, we thought we had these allergies. We didn't even know there was such a thing as desensitization. We never knew there were these therapies. And just that therapy and knowing that they can see somebody is completely life-changing. So I think that's all very, very important to me, and trying to juggle all of them together.
All right. So, but you are in the continent of Africa, and there's all these collaborations that need to happen between South Africa and the rest of the 53 countries. So, are there any, CME type of, programs, so, webinars that, you are collaborating with the people in the rest of the continent?
Yes, so we have a webinar on Friday mornings. It's generally on every Friday mornings, called Allergy in Africa webinars, which used to happen traditionally from Red Cross Children's Hospital, but now we're doing it virtually. Our Allergy Society of South Africa has a journal club which people are joining virtually, but I think you have to be a member for that. And we've got a patient organization for patient advocacy.
Is this? I used to have this book.
Yes, that is correct. And we've got an Allergy Foundation of South Africa as well, where it's a patient advocacy group, which was actually started by a mother. And what we did is we made pamphlets where any mother from anywhere, all you need is internet access. You just log on, it's afsa.co.org, and you go on and you get information about pollen allergy or peanut allergy or dust mite allergy or what is asthma. And these have been prepared in multiple languages as well to suit our South African community. So I think that's quite important. And being a South African in the European sector, especially because allergy is extremely advanced there. So I always tell my European colleagues who laugh that they have got thousands of allergists. They've got allergists for their pets. So in Europe, if you've got a dog who has a rash, you don't go to a vet, you go to a super specialist vet allergist. That's how advanced they are. Here we've got 43 million and we've got about 10 people who have a good knowledge of allergy servicing them. So constantly reminding my colleagues overseas as well that this is our South African situation. I've been collaborating with them so that, you know, even when we get data together, when they're looking at the face of asthma, the face of food allergy, that South Africa should have a voice. We should always be in those journals. We should be on the map. They should know that we exist, and they should know that we do have a good tertiary system for studying allergy, and we've got high quality education. And I think that's also going to go a long way in putting South Africa on the map, not just for allergy, but for many other subspecialties, because we are often, I don't like to say forgotten, but I think many of the African countries are not given the academic respect that I think that should be afforded to us, because we have brilliant minds on our continent, really brilliant minds. You and I are from UKZN. We have some of the best researchers in the world that have come from there.
Yes, exactly. All right. So now you are one of the leading allergologists in the country. All right. Now, what's next for you? You know, I mean, you are still young. You still have many decades of work life ahead of you. You've achieved so much already. Where do you see yourself, you know, by the time you hit 60, which is many years from now? And what kind of legacy do you want to leave, you know, when you decide, now I'm done with practicing medicine?
I'm going to be completely honest with you, Fundile. We're going to have another chat for that, because I honestly, I don't know. I don't know. I think
that's a good answer. But you obviously, as an ambitious person, you've got things that drive you. I've picked up that acquiring knowledge and skills that makes a difference is actually something that you are very passionate about. You know, you might not have been able to say, I want to be there, but certainly you don't want to rest on your laurels and stay where you are.
I want to make a difference. I think that I can say when I'm 60, I would like to look back and think that I have made a difference, not for allergy, but just generally to healthcare. And I think you're a family physician, so you understand it's one of the principles of family medicine is each patient matters and each patient counts. And that's how you start as a doctor. Not everyone can make a difference to hundreds or thousands of patients. And it's you take each patient at a time. And I think that's the legacy I want to leave. Whether or not I'm going to still be in academia, whether I'm going to be in South Africa, whether I'm going to, you know, I actually have no idea. I might just quit medicine. I don't know. And I think that all comes back to my spirituality of knowing that, you know, things have always happened the way they're meant to at the right time. And I've always had that faith, and it has always worked for me. So I will just wait to see how things unfold.
Beautiful. So, you know, what message do you have for people who would like to follow your footsteps young medics who have now, heard about your space, who would like to emulate you or find a way to get themselves to Cape Town? What message do you have for them? Guys who are not yet, decided about what they want to do, but they've just listened to you and they think this is the space that sounds interesting.
My advice to young medics would be,
Thulja?
enjoy each day in medical school.
I'm not sure what's happening there, but anyway. If there are any questions, Thulja, are you back?
I'm here.
All right.
Yes.
Yeah, you disappeared there for a short while. We will be done in less than 5 minutes. I normally do 90 minutes of this thing, and we are actually ahead of schedule. So, no, I just wanted to say, what message do you have for people who have been inspired by what you are doing and who would like to follow you as young medics?
My message to medical students is that you must enjoy each day in medical school. Make the best of each day separately. Don't start medicine with the idea. Obviously, every person is different and their personalities are different. But don't decide when you leave grade 12 that I'm going to be a neurosurgeon.
Yeah. Be
there and be present in what you do so that you take the most out of every block. And you take the most out of every single thing that you taught, and that you appreciate every a lecture separately.
Yeah. Yes. So basically, they must assimilate, get as wide as possible before they narrow down into a particular field.
Yes.
Okay. All right. To your parents, what would you like to say to them?
I think my parents already would know what I would like to say to them, but I don't think words would ever be adequate, ever, to my parents. Yeah. I don't think I could put into words what my parents have given me from the day I was born. My parents, my grandparents, and my brother, but obviously especially my parents. I am where I am today 100% because of the support, and always in the right way and always at the right time from them. Yeah. They have been extremely supportive of everything that I've always done, and I think the foundation that they set for me is why I am able to give of myself to other patients.
Thank you very much. I think we must wrap it there. I want to thank you so much for affording me this time on a Sunday afternoon, being the busy person that you are. But thank you very much because it's important that, we recognize people who are doing great things out there, and you are doing great things. And may you continue to make a difference to South Africa, to the continent, and to the world. You are making us proud, and as South Africans, and just continue doing the good work that you're doing.
Thank you so much, Fundi. Thank you to all of the viewers. It has been an absolute honor being on your show.
Lovely. Thank you very much, and all the best for your week ahead.
Thank you.
All right. Bye.